and cons of choosing anatomy postgraduate subject?
One we already talked about, that is work-life balance of no clinical exposure, obviously.
What are the career opportunities after doing MD anatomy?
I would say that if you have chosen anatomy,
Is anatomy actually an end branch?
in a way it is an end branch. You will be able to you can go into the clinical embryology, you can do in the IVF.
For a new first year student, how to actually read anatomy?
Read anatomy for yourself.
Why is anatomy important for next?
Gold medalist in the anatomy in the first year, they still struggle in the PG exam in the anatomy itself.
What do you think is the best preparation strategy?
Are good enough to get a decent rank in NEET exam.
What kind of personality trait should a student have who wants to choose anatomy as their future career?
Majority of the people choose anatomy because they did not get anything else.
How much can an MD anatomy earn in our country? We are on a mission to build India's largest community of doctors. And yes, I would need help from each one of you. Please subscribe this channel and share it with your friends, and let's make this community the best one in India. Today, we have a very special guest. He's a legend himself, the best educator and a great human being, a dear friend. And we are going to talk about a subject which people normally do not talk about. We are going to talk about anatomy. There are so many myths around this subject. It is boring. It doesn't have career prospects. There is no earning. And today, to break down all these myths, we have the legend himself, Dr. Ashwani Kumar. Now let's put our hands together and let's get everything clear by Dr. Ashwani Kumar himself. So let's put our hands together and let's welcome Dr. Ashwani. Welcome, Dr. Ashwani, to the Nachiket Bhatia Show. Thank you so much for taking out time.
Thank you so much. Thank you so much.
Sir, before we actually talk about anatomy as a subject, and I'll tell you the reason that we are going to talk about is because students who are getting the chance to take anatomy as their post-graduation, okay, so there are various apprehension in their minds. Like, is anatomy really worth it? Because when I look at you, I would absolutely say anatomy is totally worth it. But I think anatomy as a subject is considered completely non-clinical and we can say a tad bit boring. It has very limited scope. So we have all the myths around the subject. So before we move on to this part, now I would like to know the beginning of the Dr. Ashwani. How did Dr. Ashwani choose to become a doctor, moving on to choosing anatomy as a specialty, and then becoming one of India's favorite anatomy educators?
First of all, thank you so much for this glamorous introduction. After my PG from KMC Manipal, I moved to Shrikot. Shrikot is a place which is close to Rishikesh, and I worked as a demonstrator. I started as a demonstrator and eventually I worked as an AP. And then from there I went to Vardhaman Medical College where I did my SRship from, followed by the PhD later on. So the journey initially was like for anyone like in the anatomy field would be, I was teaching in medical college at the same setup. Like I had no plan of teaching at any other PGME platform. Like it was, I was happy doing that. This is what I wanted to do. So what happened eventually was by chance only. We've talked about it earlier also, that how I got to meet Dr. Bhatia. It was just a chance which, I was just completing my SRship, just a couple of days left, and unfortunately my father got a stroke at that time. So I was in the need of the job. And that time I got a call from Dr. Bhatia, like just God's grace, and I just went in to give one small demonstration, and it worked well. Had no plans to work in this field though, and initially, but when I look back, almost 15 years, so I thought, yeah, it's a great decision.
Very well say that I've been a part of your journey as well, and you were one of the first few peoples who told me that, okay, that when I was here, you actually held my hand and you told me how to basically run the whole administration part, and I'm always grateful for that. I'll always be. So boss, let's move on to the anatomy as a specialty. Now, considering that there's a huge perception in the market, in the whole medical world, that anatomy is basically a non-clinical, boring subject. So did you have any apprehensions when you were choosing it as your specialty?
Well, sometimes, apprehensions are far from reality. What you're saying, it is considered as a non-clinical subject. It's not considered, it is a non-clinical subject. I mean, there's no hidden fact about it. And even if I don't take my example, because I'm working in a different setup. So if I just go like 10, 12 years back and I think about that when I was working as senior resident and I had no Monday blues. Like this is something which I love doing. I was like always had a spring in my feet, like excited to go to the department to dissection. And believe me, if I show you my phone, I have more contact number of the dissection staff more than the faculty people. I'm still in touch with those people because I used to spend most of my time with them only, literally begging and bribing them emotionally, like to like fetch the body out of the formalin tanks, because I would love to dissect even on the non-teaching days as well. So that was something which I wanted to do. So that was one of the reason ki I would say ki I had no Monday blues basically. So anatomy came to me very naturally. I was a teacher. I was a born teacher only, and I got the first glimpse of that when I taught my younger sister when she was in a plus, like in her 9th and 10th standard. So she's the first person who told me, okay, you're a good teacher. That kind of shayad, like maybe I can do that. So that perception, it is non-clinical, but it's like you have to decide whether you want to be in clinics or non-clinics. I made a choice and I'm living with it and I'm very happy. I'm on a roller coaster ride.
The one thing that I can really, second you is that you are born to be a teacher. I have not seen a more dedicated teacher because, when I'm traveling with you, you are always, drawing the nerves here and there. And I can see that your hands are always full of your sketch pens. So one thing I can really second is you are born to be a teacher. So let's talk about anatomy in the medical college and NEET PG. Often anatomy is considered one of the most difficult subjects.
Okay.
In the whole curriculum, whether you can say it in college or you can say for NEET PG. What's your opinion about that?
Well, I would love to answer this question. When I look at the anatomy, I've always said this at multiple places, that it's the balance between the volume and the relevance. We are not able to maintain that balance between why people are scared of anatomy is because of the volume. Yeah, it is a complex subject. We need a lot of spatial orientation. Fine, understood. People who are entering into the MBBS, imagine they're coming after learning the concept of physics and chemistry. They're not dumb people. They're very smart people. So they can definitely understand the subject like anatomy, no big deal here. But the kind of volume which is imposed on them, it's not right. Let me give you an example. You have so many leading surgeons coming to your podcast. You have orthopedicians and surgeons. Do you really believe that any practicing surgeon or any orthopedician will be knowing everything in anatomy? Being a basic subject, like do you really think they'll be knowing the muscle attachment in the kind of detail we teach our first year, lateral 2/3 of this bone, proximal and distal part of that? I think that is not needed, because we cannot carry it forward. What's the point of reading the subject in a way that you cannot carry forward to the clinical world? So that sheer volume is actually draining them out. I think if we just focus more toward the relevant part, it will be a little more relaxed. Even our exam system should be like that. I mean, we want our students to be able to write long answer questions. So we're not basically judging him how much he understood the topic. It's like, is he a Shakespeare in a white apron? Can he write literatures on the topic or not? So I think that's the reason. Otherwise, as I said, if I can, and many people like me, if we can make a subject palatable for them in 5 to 6 days, imagine what we can do with them in the entire year we have. And I tell you, I mean, we have great teachers in almost every medical colleges, but the kind of work which is imposed on them, okay, they are not doing the actual duty. They are not able to do the actual duties. There's so many friends of mine who are working as an AP and associate professor, and they're saying that we are given the work like go in this committee, work for MRD, storage committee, and JRSR ship cell committees. The whole day they are just doing all this clerical file work only. So that's why so many factors are there. Otherwise, it's a lovely subject. I think the people who've understood the intrinsic detail about the subject and kept the relevance in mind, they would have realized that it's a beautiful subject to go with.
True. I remember my own days. I think the only professor you are supposed to be really afraid of in your first year is the anatomy HOD.
I don't know why this is there. Why there is always that aura of the anatomy professor is so strict hi hoga. Like I don't know why that. Why is that?
And the whole seniors always say that अगर anatomy HOD से क्लास छोड़ दी तो supply पक्का है. So this was the scenario that we grew in. And post that, I mean, even if I talk about the first year students, I believe that you have been you are an anatomist. You know the importance of each and every part of what is being taught. I think DH being one of the most important parts.
Yes.
They do have classes over there, but I don't know why they are not making it interesting. So my question to you is, what are your views? How can we make anatomy as a whole interesting in first year, so that the students, will actually love to go to DH? Because it is just that there's a cadaver lying and people around you are just opening up something. There's muscle hai, ye hai, wo hai. There needs to be some kind of inputs.
Yes.
And I think you are the best person to tell us that what kind of inputs we can do to make it interesting. Students को मजा आना चाहिए.
Table teaching has always been a big part of the academic curriculum in the first year. And I remember in our time, the table teaching, they still do the table teaching, I'm not saying that. But I don't know this, when you give the example of that patient and doctor ratio, this ratio is very bad in the number of student and the cadavers provided to them. I don't understand why this ratio is so bad. In every medical colleges, I mean, at least in the country like India, we're not running out of cadavers.
True.
So I don't know why do we have like this scarcity of cadavers everywhere, and there are 20, 25, 30 people flocking on one body only, and they're dissecting roll number wise. I've asked this question to some people, how do you dissect in the college? Say that roll number wise. What do you mean by roll number wise? Like it's like roll number 1 skin, roll number 2 facial, like that? No, there's like first few people will dissect on one day, first few people will dissect on very next day. I'm like, I don't think that if the 3 people who are dissecting on they probably they are interested. But what about the rest of the 20 people which are flocking around the table? They obviously will not be interested. They're just clicking the picture of the cadavers and posting on the Instagram. That's all they're doing. So I think one of the thing is that they should be given the hands-on on the dissection. Number 1. Number 2, that I think it is followed in many colleges and still many are not doing it, that the PGs who are in the department, they should be dissecting one side, and there should be a proper demonstration of that region. Let's say the cubital fossa is a topic to be discussed today. So a PG, I'm not saying the resident, a PG should dissect that region, demonstrate this to the students, and then they should start dissecting on the other side here. Active engagement nahi hai. It's like it's a very passive learning. Ki, okay, we'll come to this, and as you said, okay, just open kar dikha diya, and okay, you just. So that dissection thing is one thing which is a brilliant place to learn. And in the academic curriculum, there is a number of hours which is given to dissection, is lot, but उसका use नहीं हो रहा है. We are not using it. Lectures में लोग interest ले नहीं रहे हैं. Dissection में, as I said, they're sitting idle, and that's why they have to rely on the external sources. Little unfortunate, despite of having so many resources, we are not using them well. Same is with histology. True. I remember a long time back, I was taking a viva of a student. And there was a slide which, like, I have to ask few questions based on the slide. So first I looked into the slide and I'm like, मेरे से ही identify नहीं हो रहा कि what is there in this slide here. मैं इस बेचारे से क्या question पूछूंगा? That was the quality of the slide actually. So it was a slide of a hyaline cartilage, and I could not notice like the features of the hyaline cartilage. So I could not gather that courage of asking the question to the student because the slide was so bad. So I think the resources and then utilization of the resources is very important. And you rightly said that DH time should be utilized very well, which we're not doing. Honestly, we're not doing that.
True. I think if we talk about histology, I think we are just taught 2 things. One, we see a presentation of the slide. All right, of course, everything is very clear. And then in the final stages, we see in that practical examination that we have to identify the slide.
And we used to identify the slide not from inside the microscope, but from outside the microscope. Kiska corner toota hai, kis liye pukdi hui hai. That's the way to identify.
Exactly true. So everybody knew that हाँ वो एक बंदा लिख के जाता था कि ये इस पे ये और वो ऐसा बता देता था. तो सब clear है. So boss, let's talk about, since NEET PG counseling is going on, let's talk about anatomy as a postgraduate subject. Now, the first question is very simple. The pros and cons of choosing anatomy postgraduate subject.
Well, one we already talked about, that is work-life balance. Of course, it's more like a 9 to 5 type of job. So obviously you have work-life balance. You're not carrying the baggage of your department to the home. That is definitely one thing. So that's one of the biggest pros. Second thing is that you get a lot of research opportunities. I mean, if you are a research person, then you get a lot of research opportunities, because clinical people, they don't get time to do the research. So even after you're, beyond your time, beyond a time limit of 5 p.m., you can still stay back in the department, and you can work on whatever area you want to research on, be it the stem cells, be it embryology or whatever. Okay, that's a pros, I would say. You get settled early, because the starting point for the clinician and non-clinician will be the same only. Now, obviously, in the race ahead, that will be more lucrative for the clinician part, but the starting point is the same. So it feels like they settle down early in a way, because I am dependent more on the time-bound promotion. I'll be in a senior resident now I'll be in AP, so it's time bound promotion obviously. Cons, I would say the cons is that number one is that no clinical exposure. Of course, if you are a person that who want to do a clinical exposure, so obviously you have no clinical exposure. And again, in term of money, it is less lucrative. Of course, it is less lucrative comparatively. As I said, the initial will be the same, but the moment they move out of the boundary, they're definitely more lucrative for the clinicians.
What are the career opportunities after doing MD anatomy?
I would say, if that's the exact question which I want to address in a different way, that if a person starts looking at the career opportunities after anatomy and not looking at teaching, that means he chosen a wrong field. You never wanted to be a teacher. You're looking for the opportunity, like you wanted to go in a reproductive field. You want to work in an IVF, you can do that. You want to go a diploma. Some people I've seen that doing the diploma in anesthesia and they're starting work as anesthesiologist here. Why not in the first place itself? So I would say that if you have chosen anatomy, either go with that only. Otherwise, you have wasted your 3 years of yours where you would have done something else in the beginning itself here. Why don't you do the maybe diploma in anesthesia or something else, or DNB, and you moved on? So I think when you ask me, if you ask this question to anyone, they will tell you the specialization beyond their subject, like what they can do, specialize in surgery, what they can do in the pediatrics here. But anatomy, what specialization they will do? So you have to look at yourself as a teacher only, and you need to be content with that. There are chances, obviously, you can go beyond that, but again, you'll be leaving anatomy and you'll be going into something else. Why in the first place you chose that?
Is anatomy actually an end branch, or is there any kind of fellowship or super specialty possible in this branch?
No, it is in a way it is an end branch. I mean, you may say you will be able to do you can go into the clinical embryology, you can do in the IVF. Well, that again, I would say that the people from an OBG department probably have a better opportunity to working in that scenario. So again, for any, I think the preclinical branch, it's more or less limited to teaching. Like you do not have too much to expand in this. So it's narrower, but it's not closed. It's like you have progression, but in the same direction only.
What do you think is a 10-year future for this branch?
10-year future? Well, the exact same future which had it for last 200 years. The teachers will always be there. I mean, that subject will be taught in every colleges, that will be required. And, this subject is taught to the people at the biggest transition phase of their life, when they're coming from +2 and they're moving into the first year. So I think that is the place where the teacher is needed the most. You need teacher at every step of the life, but in the first year, I would say it is needed the most. So I don't think any decline in any kind of future. I'm not saying there is something like exponentially going to change into it. But whatever scope we have right now, the scope will persist, and any medical college which will come up, shuru to first year se karenge na. So when the people say there's not much of a scope, the branches are saturated. No, they're not saturated. Who said they're saturated? Tier 1 city mein everything saturated. Clinical branches saturated nahi hai. You think that if you're a surgeon that you will get into any corporate hospital? No, it's not that easy. There are already people, the big guns which are sitting there. But when you go into the periphery, you have loads and loads of opportunity. Colleges khali pade hain. They are begging people to come and join them. And they're like giving them salary of enormous amount actually.
That's true actually. Based upon this, what kind of personality trait should a student have who wants to choose anatomy as their future career?
If I give a very blunt answer to that, majority of the people choose anatomy because they did not get anything else. That's a very honest answer. Okay. Remaining 10% people, some maniacs like me, who chose anatomy, is because they wanted to teach. Okay, and I know many people like this, who chose anatomy because they really wanted to teach. I even know a person who got such a great rank in the PG exam. He was getting orthopedics in CMC Vellore. He's from CMC Vellore. I'll tell his name. He's Dr. Avinash. And despite of getting this orthopedics, he chose anatomy. And he's an amazing teacher. He's an amazing teacher. Okay, because he wanted to do that. So I think that is very important to first gauge this. Are you meant for this? So there's no trait for it. The only trait is you want to teach or not. If you're stuck at that question, if you'll say, okay, I'll choose anatomy or physiology or biochemistry, but मैं पढ़ाऊंगा नहीं, मैं कुछ और करूंगा उसके अलावा, ठीक है? You've actually given the answer to yourself कि नहीं, आप उठाओ मत इसको. Don't take that. You will be frustrated. You think you will have a work-life balance? No, you will not. Work-life balance is not only the 9 to 5 job. If after 5 o'clock, if you're going back home and you're still cribbing about the job, so what kind of work-life balance is that if you're not happy? Okay. So I think it's very important that first ask yourself, are you are you born to teach? Do you really want to teach? Will you be happy teaching throughout your life? Then only pick preclinical, otherwise mat lo yaar.
So boss, can you let me know the 5 best colleges for MD anatomy in our country?
The topmost institutes are definitely will be in the list. They always will be. AIMS New Delhi, Maulana Azad, KGMU Lucknow, KMC Manipal, and Madras Medical College, KEM Mumbai. These are some of the finest institute. Jimmer Pondicherry. These are some of the finest institute. If I think of just the anatomy part, in fact, probably for most of the subjects, they are the finest places. But I'll tell you, when you talk about the colleges, this list is very long in my head. The reason being, it's not just the name of the institute, it's the environment of the department. Anatomy is a field, it's not about the patient exposure. Na? It's about the exposure to the first year student. If you're getting hands-on on teaching the first year, if you're getting hands-on on dissection, if you're getting to work under great professors, any emeritus professor working in the college, and you get, just do a little research work, what kind of thesis have came out in the last 2-3 years from the college. I think you should make a decision based on that. Aisa nahi hai ki you will not do the MD anatomy from AIMS or from VMMC, so you're not good enough. There are amazing professors which are working in the peripheral medical colleges also. So इस field में मुझे ऐसा लगता है कि it's very important to see that under which professor you will be working, and what kind of environment is there, what kind of hands-on they will give you during your PG, especially when it comes to teaching first years.
So once we come to the most demanded question of our podcast, very simple. How much can an MD anatomy earn in our country as an SR after 10 years and in a senior position?
Well, as we said, initially it's the same. I mean, if we are shooting this podcast in the month of January 2025, so if I should quote the date, because if people are watching it a little later, so they should be knowing it. So I think that probably in the city like Delhi, senior resident and AP salary is more or less the same. It's around approximately 1.5 lakhs. And AP obviously will get, because it's being a permanent job, so they get little perk, they have pension plan and all. So SR ko wo nahi milta, but otherwise salary is more or less the same only. Associate professor is around 1.8 to 2, and professors are fetching around 2.5 and beyond 2.5 also. Having said that, I have seen that in the peripheral medical colleges, in the remote areas, I even know people, without taking anyone's name, I even know people who are professors there, and they're fetching the salary of around 6.57 lakh rupees per month.
So basically, being an anatomist in a peripheral area is better than being in a metropolitan.
It is.
Cities.
You get to get a good residence, a big residence, and you obviously have the good amount of salary. Obviously, you will not get everything of everything. Now you will not be. You don't have that city. You don't have the mall to explore. And when I told you, I gave an example of the Sri Court when I was there. So even when we were working as a resident, we got a big house there. It's the 3-room house we got there as a resident only. Who gets a 3-room house to a resident? And the salary was also very good. The salary at that time was matching the salary of the AP in Delhi. So the salary was also great, because it's a remote area. People don't want to go there, and they keep on demanding people to come in there. So if you're ready to move out, if you want to, if you're ready to settle a little outskirts of the main city, then the salaries are really good. And honestly, it also comes down to a little negotiation also. For the private medical college, it's a negotiation also which works. So you need to be a good negotiator as well.
I often feel that, especially the JRs and SR in anatomy, are overworked and underpaid. Now, is that part true?
They are not underpaid, but they are overworked. And unfortunately, they are not overworked with the academic work. They are overworked, I told you, with the clerical work, which is very unfortunate, because we have such great teachers coming up, and new generation, they have a lot of new ideas of teaching, but they are not getting a chance to that. I keep talking to many of my friends who are working in Delhi, outside Delhi also, and they keep saying that we are bombarded with all these clerical works, and we're not given that many classes which they deserve, and they want to teach, imagine. So this is unfortunate. So what you're asking is true, but I would say half of it. So no, not underpaid. I mean, it's a fixed salary which they're getting, but overworked hai, or overworked with a kind of work which should not be given to them. There should be a balance to it. I mean, itna nahi hai, it's like pure din baith ke file bana rahe hain. Clerk thodi hai, he's a teacher. Give him a topic to teach. That's the unfortunate part.
A couple of years back in NEET PG, it was mostly single liner. Now it is coming in an integrated fashion. In the upcoming next, it is supposed to be completely integrated. What's your opinion and view that how are you going to change your teaching style from basically single liners to integrated clinical questions?
Well, first of all, we are never taught as a one-liner. I mean, we've always focused on the conceptual understanding of the subject, and without clinical integration, it's never going to be interesting. If you're reading the peripheral nerves and you're not reading the peripheral nerve injuries, so what's the point of doing that? So I think that fortunately, most of us, they've never followed this single-liner kind of approach. So that is, we've not done that. But since you're talking about the next exam, the one thing which I'm really not happy about the next thing is that they're conducting one single exam, and at the end, they're basically trying to take the model of the USMLE. USMLE में तो step 1 भी होता है ना, ठीक है? So I personally believe that there should be an exam after second year also, which should make students very serious about their first and second year. Because now the next is giving a perception to the student कि अरे anatomy क्यों पढ़ना है, micro क्यों पढ़ना है, patho क्यों पढ़ना है, सीधा medicine पढ़ते हैं, ठीक है? Because that will be the clinical will be mainly asked from that part only. That perception, this is really going to affect the way people are going to approach the pre and paraclinical subject. And I think that if next is it's a very good plan, honestly. It's if it is implemented, God knows when, but if it is implemented, it is a very good plan. But I think there should be a next step 1 also, which should be exam after second year. I mean, there are models which there could be discussion on that. But I think that completely sidelining the pre and paraclinical and making the clinical oriented exam will make student, have a different or a very shady approach in the first and second year. They'll start want to read medicine in the second year itself without reading pathology. Is this the right approach?
I'll ask you a simple question that why is anatomy important for next? Because that's a very simple question that, students have asked me multiple times. I'm sure students have, pondered this question to you multiple 100 times, because as you said that everybody's under the impression that we just have to read clinicals now. Yeah. No more non-clinicals. Okay. So I'll ask you a question that why is anatomy important for next?
Okay. I'll give you an example for that. I'll want to explain with the example. Whenever, because we have to give the example of the model we are working in, whenever I go to take the class at certain centers, so sometime before me, surgery class, ENT class, ophtha class, they're done before mine. And sometime they're after my class. Now, if the classes are done before mine, and when the student attend the anatomy class, and they always come up with, yaar, kash humne pehle kiya hota, to probably our ability to understand the surgery and the ENT would have increased multifold and would have done better in that. And vice versa, if the anatomy class is first one of the anatomy, physiology, any preclinical subject is taught to them first, and then followed by any clinical subject, their attention level will increase, the interest will increase, because now they're understanding the core concept. A clinician will not be having enough time to explain them the core anatomy. I cannot expect my surgeon to come back and first teach the detailed anatomy of the inguinal canal before starting teaching the inguinal hernia. So that's my job. आप पहला स्टेप को छोड़ के सीधा सेकंड स्टेप पे जंप करना चाहते हो आप, you might be able to jump there, you will be able to do that, but amount of work that you put in and then amount of rote learning you'll be doing here, that is enormous. So I think, and that preclinical subject plays a great role in that they make you feel good about yourself. If you're good at pre and paraclinical, your journey in your medical career will be delightful. Otherwise आप stress में रहोगे, बस prof exam pass करना, बस वही एक लगेगा intention और कुछ भी नहीं.
For a new first year student, what would be your recommendation and suggestions how to actually read anatomy for both prof as well as their NEET PG or next exam?
Well, first of all, read anatomy for yourself. भूल जाओ prof exam को, भूल जाओ NEET exam को. First, read anatomy for yourself. You are entering into a new world altogether, and you're being exposed to such a beautiful architecture. And I think first enjoy that. Okay. Don't get overwhelmed. I know कहना आसान है. Don't get overwhelmed with the amount of the volume of anatomy, and eventually this will all fall in places. It's that you will be giving the examination, so you have to prepare for the prof exam also. But I think first try to learn it. And anatomy का एक बड़ा basic सा rule है कि if you want to do well in anatomy, and if you having a trouble in understanding it, try to teach it to someone. And this really works. I mean, ये लोग शायद इसको ना समझे, but I want to give this suggestion to first year कि if you find something difficult to retain, अपने किसी friend को पढ़ाना शुरू कर दो. Just draw some schematic diagram and just teach them, and you will see that you will able to retain yourself a lot out of it. Okay. Prof exam, ठीक है. I know they are tested based on little of, how your drawing skills are, how much you can draw, what volumes you can write. You have to deal with that. You can't help it. PG exam के लिए ये है कि whatever you learned in the first year, now you have to understand that how to carry this anatomy forward. You cannot carry the same volume that you read in first year throughout your MBBS or not in a PG examination. And this is where, the people who are really good, who were gold medalist in the anatomy in the first year, they still struggle in the PGME exam in the anatomy itself, because the amount of volume they're not allowed to the MCQs here. So, a little retrograde approach is required later on. It's not, I'm not in the first year, that later on that okay, what is important from this exam point of view? What are the things I need to cut down on? And then these are the points I have to focus. Even in our setup, when we have foundation students, they really do very well throughout their journey, second year, third year, and final year. But then they later on they get overwhelmed with the amount of notes they have made and so many things. So trying to compress and condense down the content is very important, which they'll learn eventually. मुझे लगता है first year में they should not be thinking anything about the NEET PG. Learn the subject, be it anatomy, biochemistry, physiology, and this will give a great kickstart to their medical career.
How should a first year student basically clinically correlate anatomy with all the clinical subjects?
First year mein, when we talk about the clinical anatomy, I know that the students, even when they're reading the clinical anatomy, they are not able to correlate it that well. Okay. So this happens little later. I mean, obviously you start reading the surgical subject from third year onwards. So जो बीच में second year वाला time आता ना, obviously people tend to forget the anatomy, and I think they need to slightly switch back to the anatomy part before starting their third year. So that is the right time they actually understand the clinical part of that. Abhi first year mein, if you let's say if I'm discussing any radial nerve I'm discussing, I will tell them about the radial nerve injuries. So they will understand, okay, radial nerve injury mein there will be wrist drop, there will be sensory loss, blah blah. There are so many things. But have you actually seen the patient of radial nerve injury? No. You probably will be able to see the patient a little later, maybe in your clinical posting. So ये जो bridge है ना बीच में, that gap that is there in the first year and the final year when you actually will be reading orthopedics, उस gap को bridge करना बहुत ज़रूरी है. So in first year, whatever anatomy you read, you have to find out the time in between in third year or before starting the final year to give a quick recap so that it becomes more relevant. First year, yes, they're reading clinical anatomy. They do have, nowadays they have like all the surgeons and orthopedicians coming to teach them for the vertical integration. There all these lectures are there. But I understand that they're not able to understand the clinical anatomy completely. But okay, let's learn the anatomy. You know the relevance here. And once the bridge is closed, you will be able to do very well in your pre-final and final year.
Can you suggest some, tips, tricks, how to basically remember the diagrams which are taught in the first year?
Look, I'm decent at drawing diagrams here, but I always say that you are not tested on your drawing skills here. Though unfortunately we are doing at times, but a student should not be judged on their drawing skills. Anatomy is a subject about the spatial orientation. अगर उसका spatial orientation उसके head में अच्छा है, and if he's not able to produce that on the piece of paper, you should not be judging that student based on that. If there should be ways to do it. I'm not against conducting an MCQ-based exam because of this only. Because a student should be tested in a real manner कि उसको subject आता भी है नहीं आता है, and not कि how well he can draw or something. From the diagram point of view, one of the USP of my class is the schematic line diagrams here. It's if you look at a Netter's Atlas, everyone knows Netter's Atlas. Now, if you look at the Netter's Atlas, that picture is overwhelming. I mean, उसमें इतनी सारी labelings है, आप उसको देख के डर जाते हो, ठीक है? But if you have an approach that you first just move to the schematic line diagram, understand the basic orientation. दो circle बनाए उसको superior colliculus बोल रहे हो, चलेगा, that is okay, ठीक है? And then switch to the atlas and then try to locate those structures in the atlas. This approach is going to help you. Rather than directly reading the text and directly compare the text with the atlas, थोड़ा आपको difficult लगेगा उसमें. तो I think mastering those schematic line diagrams will make a framework in your head, and then you'll be able to superimpose that framework on the actual picture looking in the atlas. That approach have always helped me. I can look at any cadaveric dissection picture and I can make a schematic out of it. And I've learned it this way only. I first make a spatial orientation about that image schematically and then try to superimpose the image on the actual atlas images, Netter's Atlas or whichever. So I think that's the way to go. Specifically you asked about the diagram. So that's.
Thank you, boss. Let's talk about NEET PG 2025.
Okay.
Specifically.
Ajay.
So what is the best preparation strategy for a student who is basically halfway in the preparation because the exam is now almost 5 months, all right, or a student who is preparing now? What do you think is the best preparation strategy?
See, given that 5 months is there, now because it's 5 months, so I can take a liberty of saying that 5 months are good enough to get a decent rank in the NEET exam, even if you start almost from the scratch. Okay. So there's still a decent chance. We might not be saying the same thing if the exam is 2 महीने रह गए हो, तो obviously किसी को झूठी दलासा नहीं देंगे कि okay, no, you still be able to do well. And especially if you're free, I mean, if you're not having any internship duties or something, and let's say you're free for the next 5 months and dedicated completely in studying, you can do that. I think 3.5 months of watching these lectures or attending face-to-face classes or something, and then the next 2 months, if you can somehow fetch the time to give the 2 revisions, you will be able to do it here. Yeah. A little smarter approach will be required because there are people who are preparing right from the second year itself, so obviously they will have an advantage over you. So I think a little smarter approach will be needed. I would, which I call it a little retrograde approach. First, find out that what are the topics which are important in that particular subject, and then base your structure, syllabus around it. And yeah, any platform. I mean, regardless of which platform you're studying it from, any coaching institute or PGME platforms, they really play a great role in that. Like especially when you have this 5 to 6 month. खुद से शायद करना थोड़ा मुश्किल होगा because you might not be knowing how to approach it. So I think you should take a help of these platforms. We always say it's always a fight of how can you retain so much of it. So फिर से वही है कि volume पे ज़्यादा focus नहीं करना है. Like if you read decently based on the previous year question, you read about those PYTs here. If you are able to do good revision to that and if you can retain it, you will be able to get a decent rank. देखो first rank करके भी 100% marks तो नहीं आने वाले ना. So if 200 में से if you're scoring somewhere around 150, you're gonna get a great rank in that also. So 50 क्वेश्चन तो आप भी गलत करने की, not गलत करने के, but I would say for 50 क्वेश्चन की लिबर्टी तो आप भी ले सकते हो कि you can leave them and if you get 150 right. So it's not about reading everything, it's being smart about the preparation.
Was many students have the habit of basically marking on luck and everything. They tend to go about, marking all the questions. Now, do you think it's a right approach to, answer all the 200 questions, or the person should basically keep in mind that every question they're actually leaving and not marking wrong is basically saving them 5 marks? What do you say?
I think the new pattern that they have in which the paper is divided in 2 parts. This is something really in our favor. Because now you have like a limited set of questions, and in the first set only you'll get an idea that how much I got the correct. Let's say you got good number of correct answers and you only just got 5 incorrect there, or you left a couple of questions there, and you said, okay, I've done decently well in the first part. You can follow the same approach in the second. So even if you end up doing, let's say, I'm just saying, give an example, let's say 160, 170 question also after 200, you've done decently well in every part, then it is okay. But let's say first part kiya and it went very well. God forbid if you are not able to even answer 50% questions. Now you know ki the second part second part is also not going that well, and you know that I'm not gonna get fetch great rank because मेरा पहले 2 पार्टी खराब हो गए. So I think you have to go a little aggressive in that, because then वो conservative approach है वो कहीं लेके जाएगी नहीं, because it's like अब तो do and die वाला हो गया. Okay. If you had a good start in the first, second and third set, then I would say you have to make a decision for the last 2 sets that how you're going to approach it. Okay. If you've done decently well, number of questions आपने अच्छे attempt किए हैं, and you think, okay, I should not be demeaning my effort in the first 3 attempts, then you have to be very careful in the last 2. You will make a decision based on that. Ki should I be going for more number of questions or less number of questions? Because approximately if I mark around 190 question, that is good enough. But nowadays, because the ranks are so close to each other, so generally it is advised that people to go a little aggressive. Little aggressive in NEET, not that aggressive in INI-CET because of the difference in the negative marking that ways. So yeah, I mean, even if I know people who have marked all 200 questions getting great rank. I know people who marked 180 questions still got a great rank. It's about how many incorrect you got, and this partitioning this paper into these 4 or 5 parts, it is in our favor. That gives you an idea about how to approach the next part. So I would say make a decision halfway through कि अब मुझे क्या करना है, मुझे लास्ट वाले 2 पार्ट में अग्रेसिव जाना है या नहीं जाना है. इट्स लाइक कि मेरे 3 पार्ट में ना कुछ नहीं होने वाला, आई विल जस्ट गो ऑल गन्स ब्लेजिंग, एंड देन यू थिंक नो आई एम गोइंग वेल, ओके, होल्ड ऑन सेल्फ, डू डिसेंटली, करेक्ट मार्क. जब लग रहा है कि इफ़ यू आर कंफ्यूज बिटवीन 2 ऑप्शंस, गो ओनली फॉर दोज 4 आंसर्स. इफ यू आर कंफ्यूज बिटवीन 3 ऑप्शंस, kind of leave that question.
Thank you, boss, for that. Boss, how can a student who is going through a stressful internship how can he possibly manage his both physical and mental health while actually preparing for NEET PG?
Internship can be taxing, no doubt about that. But it can be taxing physically, but I think it should not be stressful. I mean, an internship honestly is one time in your career when you'll be learning the maximum. Whatever you learn in those 5 years, it all come down to that internship itself. So it's a great learning phase. And the statistics tells us that the people who are able to get great ranks, even the single digit rank, are the most of those people who are actually got the rank with internship only. Okay. I'm not saying other people cannot crack it. We have like loads of example who got great rank after preparing for the internship. अगर आपको लग रहा है कि internship is getting too overwhelming for you, तो I think you should focus on internship only. अपनी नीट पीजी की प्रिपरेशन को छोड़ दो, ठीक है. एंड देन यू कैन गिव couple of months after the NEET PG, after the internship, and you go for the next written. You must have seen this is a trend which is followed, especially in the southern part of the country, in Bangalore, in Chennai, in Kerala. People, they complete their internship. Most of the places, I'm not saying in North में भी होता है ऐसे, and then they like dedicate their complete 6-7 months for the preparation because they don't want to lose out on the internship part है. Compulsory internship भी है, and they know कि दोनों चीज़ साथ में नहीं होंगी. So why to kill yourself? There is no race against time. 6 महीने अगर आप बाद में पीजी कर लोगे तो कुछ कोई आफत नहीं आ जाएगी इसमें. It's important that you take care of yourself, take care of your health. So I think if you are able to manage both simultaneously, good enough. Otherwise, internship definitely has to be your priority.
So how can a student basically manage anatomy with preparing with other clinical subjects? So how can he study and revise anatomy while preparing with other subjects for NEET PG?
No special treatment to anatomy. I mean, it's one of those 19 subjects only. So as much as stress you will give to any subject, you should give to anatomy only. So I'm not saying to undermine it, but like इसको कुछ overemphasize भी नहीं करना है. And when you read the anatomy for the first time, that's a different story. But in your second revision, and I always say this to the student, that in your revision, it's very important that you integrate the anatomy either to the clinical part or clinical part to the anatomy. You will not be reading the core anatomy after that. आपने peripheral nerve injuries anatomy पढ़ा है, ortho में पढ़ा है. But why would you want to do that in your revision type? दोनों जगह से क्यों पढ़ना है आपने? If you find some extra tests or something in orthopedics, just write it in the anatomy notes, or vice versa, maybe something anatomy into the surgery or ortho notes here. So diffusing the anatomy into the subjects as much as you can is very important. आप OBG का revision कर रहे हैं, तो why don't you read perineum with that part only? आपने न्यूरो मेडिसिन पढ़ना है तो आप ब्रेन स्टेम सिंड्रोम में ब्रेन स्टेम पहले क्यों नहीं पढ़ लेते हैं वहाँ पे? हाँ, देर आर सर्टेन कोर एनाटमी टॉपिक्स विच विल बी लेफ्ट, बट दैट विल बी वेरी स्मॉल पोर्शन. सो एनाटमी आपको इंडिविजुअली पढ़ना ही नहीं पड़ेगा, but that you have to work very smartly on that, and that is done during the first revision only. That how you're going to diffuse this anatomy into now joining, okay, इस वाले part को मैं यहाँ पे add कर देता हूँ, इसको यहाँ पे add कर देता हूँ, so that when I have to revise anatomy, I have nothing much left. Maybe some embryology part, histology part, I have to read that. Otherwise, rest everything is gone with the clinical part itself here. But that comes only in the first revision only. आप पहली बार पढ़ते हुए आपको नहीं होगा वो आपसे.
Thank you, boss. So boss, I'll ask you this question: that what is the main difference in the types of questions asked in INI-CET and NEET PG? And I also have a bonus question also, that what is the difference between USMLE questions and our Indian exams?
INI-CET and USMLE question, I can kind of correlate little to each other because there is a lot of clinical integration in them. Nowadays, even NEET is asking a lot of clinical questions. From the overall exam perspective, the ratio of question, I would say, anatomy is, or any pre or paraclinical subject is asked a lot in INI-CET. Everyone knows that. Like you cannot crack INI-CET without knowing the pre and paraclinical, the anatomy, biochemistry, physiology, pathology, they all play a great role in fetching the rank. In fact, you talk to any top ranker, they will say that strength was their pre and paraclinical. NEET में ऐसा नहीं है. NEET में it's other way around. Core anatomy कम होगा. It is there, obviously it is there, but again it is integrated with the clinical part. So you may not be getting again direct question on the nerve, but you will get a question on the nerve injuries. You will not get a direct question on the brainstem syndrome. So that integrated part will be there. So that's one difference. That's why when you look at when you do all those question recall after the exams, we generally have less number of questions discussed after the NEET in anatomy part and more in the INI-CET because they love to ask. And INI-CET is, despite of so-called a little difficult exam in the country, but it is more predictable. INI-CET, they generally stick to their topics, but they are smart enough to frame the question in such a way that every time it looks like a new question only. That's their smartness. Otherwise, they generally don't go out of their, out of the boundary. They keep on asking the same thing over and over again. I keep giving so many examples in the class that it's the same question asked like 10 times, but in 10 different ways. So that's what we have to learn in the class. USMLE, the question will have an integration of everything. USMLE में आपको उसी क्वेश्चन के अंदर एनाटॉमी मिलेगा, फिजियो मिलेगा, बायोकेम मिलेगा, सब कुछ मिलेगा. तो इट्स लाइक अ लॉट ऑफ integrated questions are there. Long language STEM questions will be there. But again, the people who have done well in the NEET, the same people are the one who done very well in the USMLE only. तो कोई ऐसी जादू की छड़ी नहीं कि आपको अलग से कुछ पढ़ना है उसके लिए. It's the same subject you have to read. If you have a good clinical orientation, good clinical approach to any pre and paraclinical subject, you're going to do very well in USMLE also.
So, boss, I'll ask you a question. Since you are an educator and you have seen the complete fields, both foreign medical graduates and Indian medical graduates, I'm sure that, like me, you also believe that the FMGs are always given step-son treatment. All right. Yeah. I don't know why, but new and cruel ways are taken out. New policies which have no sense at all are basically taken out for FMGs, and it's like they don't even belong to this country. The passing rate is so low. They are asked to do, double internships without payment, 3-year internships without payment. Then, especially also next, new rules for them, which always confuses me. Why is that happening? So my question to you is, what is your opinion regarding all the things that are happening with FMGs?
Well, I think what is done with the FMGs is absolutely not right. These policy changes, it's really tortuous, and I think they should be treated like our own only. This double standard of first you're keeping a 50% passing percentage for the FMGs, and then you're doing आप NEET PG में 0 percentile कर रहे हो PG के लिए. This is a double standard. Okay, why are you making such difficult standard for them? So I think what you said is absolutely right. I mean, we have to treat them right, and the exam, I think that 50% passing percentage, people say it is a pass and fail exam only, but 50% है यार, it's not less. So I think it should come down a little, and they should not be doing that double internship and no pay posting. That should not be there.
Thank you so much for that, boss. And the last question for the day before we move on to the rapid fire. The question is more on a prediction about the medical field rather than normal education. So my question is that which do you think actually will be the top 5 branches in the upcoming 10 years in our country?
Medicine will always be there, of course. Pediatrics, dermatology, radiology is there. People might say that radiology will be replaced by AI and all. That's not going to happen. So radiology obviously will be there. And then when you talk about medicine, obviously you have to talk about the specialization also. So cardiology and neurology will always be on the top, I feel.
Thank you so much, boss. It has been a great conversation, but it doesn't end. You know the journey now. You have already played it before. So it's a very simple game. You have to speak the truth and you have to be super spontaneous with us. So are you ready?
Is it rapid fire?
Yes, sir. It's a rapid fire.
पहले इतने सारे पोलो खिलवाई आपने मेरी.
Okay, sir, let's start. If you could time travel, which era would you visit?
Era of 90s, where the most important decision in the day is to whether to watch Shaktiman or the Malgudi days. And when you have to talk to your friends using all those cord wale phones, and there's no other way to communicate. So I think that was playing Mario and Contra. That was an amazing time.
Do you remember your phone number? Uska phone number?
I remember my padosi's phone number, but don't ask me why.
Okay. What's the one thing on your bucket list you still haven't done?
Space travel.
So इतनी सीधा छक्का ही मारा आपने तो आगे.
No, because there are a lot of adventure sports which I've done. I've done scuba diving, deep scuba diving. I've done bungee jumping. I've done paragliding, rafting. ये सब बहुत बार कर लिया है. I think this is one thing is I want to go to Antarctica. One of my friend Dr. Rajeshwari went to Antarctica. Since that I have in my mind, I want to go to Antarctica as a part of a medical unit or something, or space travel. Like it's a tough choice between the two.
What's the secret hobby of Dr. Ashwani we do not know about?
Secret hobby or talent?
Secret talent.
Talent. Hobby to secret नहीं होता. Secret talent. You asked me this question last time also,
Yes.
actually. Then I told you that time that my secret talent is that I'm very good at cleaning utensils. Okay. But since my daughter is born few months back only, so I have learned a new skill of cooking as well. So I think मैं बर्तन ज़्यादा अच्छा cooking में हूँ. That my wife made me realize that कि I'm good at cooking.
सब क्या बना रहे हो आजकल?
अभी तो कुछ भी नहीं बना because I'm in India. My family is back there. So अभी तो कुछ भी नहीं, पर वहाँ पे था तो I was cooking everything, almost everything.
Okay, favorite dish of Dr. Ashwani?
दाल चावल.
What's the one food you can eat every day without getting bored? The answer cannot be same.
One food an answer corner करने में चाहिए, ये क्या बात हुई?
यही तो है ना, थोड़ा सा अलग बताना पड़ेगा आपको. तो लाल चाल तो लास्ट टाइम भी था.
राज बचाओ.
फेवरेट मूवी?
Shawshank Redemption. Every time the movie is all about hope. If you've not watched that movie, have you watched that movie?
I have watched the
I mean, that is one movie I remember every single dialogue, word by word. If you play that movie on mute, I can kind of speak out every single dialogue. And there's one dialogue in that movie which is about the end. Dude rephrase says that it was about the hope. It says, "Get busy living or get busy dying." Oh, like, it's goosebump. Like every time I watch that movie, that's one movie that is always there in my phone downloaded. And मैं इतनी बार travel करते हैं तो मैं उसमें कितनी बार देख चुका हूँ. This is like my favorite movie all time.
Thank you so much, boss, for this meaningful conversation. I think you have, shown us that anatomy is a lot. The myths have been broken. So thank you so much for that.
Thank you so much. Thank you for inviting me.
And thank you so much, guys, for watching today's shows. I believe everything you could have learned from the legend, that has been, it's just more. I can't, there are no words to explain the kind of conversation we had today. Everything about anatomy has been made crystal clear to us. What more could we ask for? So let's thank the legend. And who do you want the next guest to be? Please write down in the comment section. And as always, you have to message that particular enlightened guest to please come to our show. We would be more than happy to host such legends on our hot seat. So thank you so much for that. And yes, it is hot seat. Thank you so much for that. God bless you. All the best.